So let's start now one by one treatment. So can we go first to the lip filler? I think that's very famous. Lip filler आज की डेट में because credit goes to the Bollywood and all the stars, celebrities. बट अब आजकल इन जनरल भी लोगों ने बहुत ज़्यादा यूज़ करना चालू कर दिया है लिप फिलर को. सो क्या हम लिप फिलर के बारे में बात कर सकते हैं? कैन वी गो इनटू द डिटेल ऑफ दिस?
So lip fillers is something that is, I feel, is necessary for everyone. Have you seen that video on Insta and TikTok? You get to see a video where the lip is aging.
Hi Surya, welcome to Connecting Global Vision. It's a pleasure to have you in our episode where we will learn so much about skin, Botox, filler, lip filler, so many things. So we are happy to have you in our episode. Welcome.
Thank you, Neha. I'm so excited to be here. I was looking forward to this. Let's get started.
Yeah, amazing. Okay, so can you please tell about yourself? Right now you are in Dubai, as we know. So can you tell a little bit background about yourself to our viewers?
Yeah, so I am actually from India, but I grew up in Dubai, and I have been, I did my education here related to school. After that, I shifted to India for my bachelor's in medicine. Having worked there for a few years, I came back to Dubai and I started looking into what are the other fields of medicine that kind of relates to me. I always wanted to become a surgeon, but it's a little far-fetched for me considering my family and, personal reasons. So I felt like aesthetic medicine is the way to go, and it is getting into becoming a new field of medicine. And I feel like aesthetic medicine and longevity medicine is going to become a big hit in the future, in the very near future. So that's why I started off with this.
Okay.
And right now I'm working in Dubai. I've been here working in aesthetics for almost, I would say, 5 years. And I have my own clientele of satisfied clients. And I only hope to grow and make more happy customers. So I grew up in Dubai. I did my schooling here. I went to India for my bachelor's in medicine. After that, I worked there for a couple of years. Came to Dubai and I got interested in aesthetic medicine. And what would I say? I've been in love with this field of medicine and only look forward to growing more in this field.
Any reason that why you choose to be in Dubai? Any reason why you specifically want to be in Dubai or why you came back?
So, like I said earlier, I grew up here. So I really like this place. Also, it's very comfortable considering having a family life and having a child, because there are a lot of complexities when it comes to parenthood. And considering education, easy access to babysitting, nanny, and also a tax-free place to live. And let's not forget that it's a very progressive place, and people like to take care of themselves here. So the field of aesthetics is booming here. So I think I see myself here for many years to come.
Before we will get into the detail of different treatments, just a few questions as a viewer, which I always wanted to ask, or I think definitely many people wanted to ask. Are these treatments which we see is really good for the people or not, or it depends on skin to skin, or is there any side effect of treatments 10 years or 20 years down the line? Because nowadays people are doing the treatments in early age. So if you're doing treatments at early age, so are there any side effect of that or not?
So Neha, that's a very good question. And it also depends on what is the treatment we are doing. If you're looking at something simple like skin boosters, Botox, fillers, all that is great. And usually the side effects are associated with a brand, a specific brand, if it is FDA approved, if it is registered under the Ministry of Health. And it also depends on the hands of the doctor. Is it done, first of all, by a licensed physician? All these are the reasons why you may end up with a side effect. Also, there are some kind of adverse reactions to certain procedures. You may have an allergic reaction. Uh, I wouldn't say that these are very common, and yet they are not very rare as well. So we need to always take a history, consider the past of the patient. Are there any chronic conditions that the patient is suffering from, any autoimmune diseases? That could be a red flag for doing such procedures. But these are all about the simple aesthetic treatments. These days, there are a lot of other new treatments like stem cells, exosomes. I haven't really started practicing with those because I still want to wait and see the data of how people are able to tolerate these procedures. Are there any long term side effects of stem cells and exosomes? This is still a question mark. There's not much data on it because, as you know, it's something relatively new. However, hyaluronic acid fillers and Botox has been there for a long time. So these are considered safe.
Okay, okay. So if I have to ask you in a simple question, और मैं ये इसलिए बना रही हूँ क्योंकि मुझे छोटे clickbaits के लिए
Tips.
चाहिए. So if I have to ask you a simple question, what are the red flag before you going for treatment? What would be the top two, three red flags you would suggest or you would like to share?
So, related to treatment or red flag
Yes.
related to a clinic?
Related to the treatment, and if you want to say about clinic, if I'm a new person and want to go for the treatment, what are the things which I should take care of before proceeding for the treatment, as well as if you want to add for the clinic, that would be super.
Okay. So red flags can be based on the products that you use. Number one, it has to be FDA approved. It has to be registered under the Ministry of Health of the country where you're living. Secondly, the injector has to be licensed and preferably it has to be a physician or a nurse practitioner. In the UAE, it is only physicians who can inject, but I'm sure that outside in the UK and US, even nurse practitioners are allowed to inject. Then again, there are countries where other people who are not healthcare workers are injecting. That comes with its own red flags. Now, coming back to a red flag is if a physician or a provider is not willing to show you what they're going to inject for you, then that's a big red flag.
Yeah.
Secondly, the injection needs to be prepared in front of you. So you know this is the same thing that you're injecting. And thirdly, and the most easy red flag is if you find an offer online and then when the patient comes to the clinic and if the treatment that the patient is asking for and the price is different because in the marketing it's one price and then in the practice it's a different price, that's also a red flag, a very easy red flag to spot. That is kind of a hint that there is some kind of unethical practice happening and you can just run away from there.
Yeah, definitely, especially if you're getting the more discount on this.
Yes, the more discount or the more the price is low. Like there is an industry standard, a range in which the price is set. If any clinic or a practitioner is giving you something for a very low price, then I can guarantee you that it is not the real stuff.
Okay, yeah. And is there any procedure that you can test before and can see whether it is allergic to your skin or not, or you can directly go with that?
Literally everything, if you insist for testing, you can test. There are some treatments that I recommend the patients to test for. Like, for example, if I'm going to do an enzyme or like dissolving the filler or fat dissolving enzymes, I would like to give a test dose for this because it has a higher incidence for allergies. However, when it comes to Botox and fillers, we generally don't recommend giving a test dose. But personally, if the patient feels like they need to test it, they can test anything. And the test dose takes only around 40 minutes. The doctor would just inject it on the forearm, and you would get to know a reaction if If it has to happen within 40 minutes, you will get to know. However, the person's allergic history is also relevant in this case. If you're a person who is allergic to a lot of things, then it's best to not do these kind of procedures.
Okay. Yeah. I think that's really helpful for everyone who is who all are watching this. So let's just start now one by one treatment. So can we go first to the lip filler? I think that's very famous. Lip filler आज की date में, because credit goes to the Bollywood and all the stars, celebrities, बट अब आजकल इन जनरल भी लोगों ने बहुत ज़्यादा यूज़ करना चालू कर दिया है लिप फिलर को। सो क्या हम लिप फिलर के बारे में बात कर सकते हैं? कैन वी गो इनटू द डिटेल ऑफ दिस?
So, lip fillers is something that is, I feel, is necessary for everyone. Have you seen that video on Insta and TikTok? You get to see a video where the lip is aging. I'll send it to you. So, in that video, you can see that when we are born, we have fuller lips. And even when we are kids, we have really full lips. And when aging actually starts, that's around the age of 25, 26, the lip actually starts wrinkling. Have you
25,
noticed that when you put,
26, so early?
aging starts very early.
Oh my
Aging
god.
to start hota hai 22 पर.
Oh wow.
Because our body stops making its own collagen. That's when aging begins. I wouldn't say stops, but it reduces the production of collagen. So
Correct.
that's where the aging actually shows up. You get to see graying of hair, you get to see thinning of hair strands. Then you start seeing lines on the forehead, maybe very fine lines. You start seeing a lot of pores on the face. Then wrinkling of the lips. This is the very common thing, by the way.
Correct.
When you put the lipstick, you feel like lipstick covers the lip, लेकिन ये lines होता है lip पे.
Correct.
That is first indication that the aging has started. अभी lip filler या फिर lip booster start करना है. तभी हमारा lips, it will stay smooth and full. It's not that you have to inject a lot of filler, but once in a while, maybe once in a year or two, you can get a little bit of lip plumping done with fillers and lip boosters. And it's a really important treatment to do if you want to look younger.
Oh wow. Is there any side effect of this treatment?
So side effect is the same like I told you before. It is related to the injection technique. If it
Hmm.
is not injected properly, then actually treatment is associated with its own risks. And most of the time, it's related to the hands of the injector who's putting the injections. So if the filler is not done in the right way, there can be lip filler migration. As in the filler which is in the lips can actually migrate to the top of the lip. You might have seen people with duck lips. This is
Yes.
because the reason for that is because there is filler migration. The filler in the lip actually went up. This can happen in two ways. Maybe because the doctor has injected from the wrong point, which is outside the lip, or secondly, it can be because there is too much filler in the lip. So always we have to inject the right amount and in the right place and in the right technique. It should be fine.
And that's the what the skill of the doctor matters.
Yes, definitely. The skill matters, the hands matter, and the product also matter.
Exactly. I'm not sure whether I should ask this question or not, but is it okay for you to share that what is the range for the lip filler in general as per the market standard? So that when people are watching this, they can relate, okay, this is the standard, at least in Dubai or UAE.
Okay. Okay. So by range, you mean the prices, is it?
Yeah,
Or the age?
yeah, price range.
Okay, the price range, it can vary from which brand of filler they are using. But generally, I would say it starts somewhere around 900 dirhams and it can go all the way up to 3000.
And what are the top brands you would suggest in this?
Personally, there are a lot of fillers that's available, but my personal choice
Yeah.
is Stylage, Juvederm, and there's also the affordable option of Revelax, which is a Korean brand. I really like it for the people who do not want to spend a lot of money on their lip filler. Then they can go for Revelax, but the ultimate filler that I like for lips, especially the technique that I use, the one which suits the most is Stylage.
Okay, okay. So it is the one which you personally feel are the good and the safe one. Yeah.
Yes, even Juvederm is a great brand. It is a French company. I think it has been acquired by an American company called AbbVie, which owns Botox. But it is the most trusted filler. So for people who want to just go with the regular, do not want to change anything, they want to keep
Yeah.
it the same throughout the for the next decade, they can go for Juvederm.
Okay, wow, that's good. And just because you're saying this, I was thinking that obviously you are in Dubai, UAE, it's easy for people to reach you, but can they get your service or do you operate outside Dubai also?
At this point of time, I'm working only in Dubai.
Okay.
Uh, I was in Abu Dhabi earlier. I do not plan to go back there because I feel like people kind of come to Dubai to do these procedures anyway. They
Oh,
want to have a tiny vacation, like a staycation at a hotel, get their procedures done, relax a bit. So I feel like everyone from within UAE and even people from Oman, Bahrain, Qatar, Saudi, everyone wants to come to Dubai for this. So I think this is the place to be.
yeah. Okay. Yeah, just wanted to know from the audience perspective. Okay. Is there anything else we can cover in the lip filler, or do you think that a person should aware of before taking this lip filler? Is there any precaution or anything which they need to take care of after lip filler or during this procedure?
So generally, people come to me for consultations on lip fillers, and the first question that they ask is, "What is the downtime?" That is, how long will they have any swelling, or if there are bruises, how long they will last. So I always tell them that you have to keep in mind that the lips will be swollen for 2 days, and the actual lip structure of the filler will only appear at the end of a week, and at that time you might want to do a retouch. Bruising is not common, but yet we still do convince people that bruising may happen. It's a possibility that cannot be overlooked. And and aftercare for the filler is that we recommend people to not drink hot fluids or eat like hot soups, noodles, coffee, tea. You can have it all at normal temperature
For how
because
many days they cannot have the hot fluid?
so we recommend that at least for the first week we have to take care of it, and then after a while they probably can still stick on to it because the more you stick onto it, the longer the filler will last. Because filler can get metabolized and they can get disintegrated easily if they're exposed to heat. So the longer you take care of it, drink lots of water, the filler should last for longer duration.
I think we discussed everything about the lip filler. Yeah.
There is one thing
Yeah.
that uh, here in Dubai, especially because we have a lot of people coming from different countries, it's a common thing here for even women to smoke.
Yes.
So we recommend that smoking has to be avoided after fillers. So that's also included in the regime. So post procedural smoking, vaping, shisha, all this also has to be avoided.
Hookah and all. So for how
And we
many?
we permit kissing as long as it is not French kissing.
Yeah. And for how many days this all are prohibited? For 1 week?
Oh well, the longer you keep it, it's better. But at least for the first week, be extra careful.
Oh, okay. Okay. Thank you, doctor. I think that's really helpful. And I think these are the small tips and things which people are not aware of or they don't take care, and then it might not result in what they are expecting to be. Yeah.
Yes.
I think that was really useful. The next section, which we will cover right now, is the Botox. I think this is a big word, but nowadays, what at least I can see in UK and now even in India and in Dubai, we already know that people are doing it so much in the sense every age. It was a time, I think, a decade ago when people used to think Botox is only for the 55 plus or 50 plus. But I think nowadays, this is my observation, that people are doing Botox in early age also. So, yeah, we would like to know about Botox. How safe is the Botox? And yeah, please share the detail.
it's really good that younger people, I would say that everyone born after, I would say 80s, 90s, 2000s, they are all more aware of how to take care of their skin and how to stop aging or prevent excessive aging, you know. So I think these days I find a lot of young people coming to my practice than people who are middle aged, and that's because they
When you say
realize that.
young age, sorry, when you say young age, what is the age range or gap?
So I think everyone needs to start Botox. If you're starting Botox, the ideal time to start Botox would be from the late 20s or at least early 30s.
So, if
And
you are going for the exam, especially nowadays, laser hair removal is also very famous. So, if you are going for such things, is there anything that as an Indian one can ask for, that what should be the wavelength?
yes, that's a very good question. The wavelength for laser hair removal for Indians, let's keep it very easy. It's Nd:YAG.
It
It's
is?
10 Nd:YAG. Nd:YAG laser wavelength, and the wavelength is 1049 mu meters. This is the wavelength that has to be used on most of all the Indian skin. Unless you are like very white or you have like a white auntie or uncle ancestor who came from Europe, then
Exactly.
then you are a type 1, type 2 skin, type 3 skin, even. You can go for other forms of lasers, wavelength of lasers like Alex. You know,
Yeah. But mostly,
in
if we are seeing Indian skin, brown skin, then it is 1049, right?
1049 is the safest, like there is no doubt about it. This cannot pigment you unless the laser technician wants to give you a pigmentation, you know.
Yeah. Yeah, I think that's a good point because many people go for such treatment. So now they can ask for 1049 wavelength for the
Yeah,
laser treatment.
yes,
Yeah,
yes.
that's good. Is there anything a red flag for pigmentation also, or people should be aware before taking pigmentation treatment, or is there anything they are not aware of?
I think the most common red flag is if you see a doctor and the doctor guarantees you that your pigmentation will go 100%. I will make it better for you. You will look like you never had pigmentation. Yeah, tata, bye bye. This is an unrealistic expectation. You cannot promise this to a client. You cannot do that. You have to always set realistic expectations. Speak in percentages. You can say that it will be 50% better, 60% better, maximum 70%. But more than that, it's all, in God's hands. So that's what in Dubai, what we say when patient ask about how much will my pigmentation go, we only say one thing. So I think the red flag is here. If you're giving a patient unrealistic expectation, then that's the time you have to leave the clinic. Secondly, if a doctor is recommending skin whitening IV drips, glutathione, tranexamic acid IV drips under the statement that if you do 6 sessions, you will become very fair. Like you are actually type 5, but you will start to look like type 3. This is again unrealistic. It is not going to happen. You are only going to load the patient with too much levels of glutathione and tranexamic acid, and you will develop a lot of side effects related to it. So that's
Then,
another red
because
flag.
now you are telling me, I'm just thinking, then how come the Bollywood stars they look so different?
See, that is a combination of a lot of things. Yes, they might have gotten glutathione IV drips. Commonly, these Bollywood stars get glutathione IV drip, not just because it helps with maintaining the skin. I would say in skin, the goal of using glutathione should be to maintain the complexion. As in, if you are somebody who has type 5 skin, don't think that you want to become type 4 or type 3, but just think that "Ki, I'm having a little bit tan here. This part of my face is more tan, and this part of my face is a different color." So, the goal of glutathione should be that you want a uniformity in the complexion. So That's where you need to draw the line. And
Correct.
why the stars get this done is also because it is an antioxidant. And obviously, when you have antioxidants in your system, if you have had any free radical injury in terms of, let's say, smoking, or if you had a viral infection, COVID 19, or influenza, or if you, let's say, had typhoid, or you're recovering from a disease, you have a lot of free radical injury, you're somebody who underwent chemotherapy for cancer. So for cancer patients, actually glutathione is given mandatory because it actually helps with recovery of the body from the chemotherapy side effect. So I feel that there are many reasons why we can use glutathione, but to change complexion, that is the wrong reason for it, and that's where you should draw the line. If you use it, you know that your skin is going to get better, it's going to be softer, and if you had patchy appearance, that is going to be rectified, and that's about it.
नहीं मेरा क्वेश्चन ये आई डोंट नो वेदर वी कैन कवर इन पॉडकास्ट पब्लिकली और नॉट बट मेरा क्वेश्चन है लाइक इफ यू कंसिडर माधुरी दीक्षित उसके स्टार्टिंग के मूवीज में देखो एंड नाउ इफ यू सी देयर इज अ मतलब drastic change. Kajol, drastic change. So why it's like that few Bollywood actors have so much difference in their look before and after 5 years or 6 years down the line, and there are quite few of them where you can see a drastic change in their skin color or in their look.
So there are many reasons why they start looking much better 1 year, 2 year, 5 years down the lane, because it's not just that they got an IV drip. It's also because their skincare routine has improved. They are doing a lot more treatments and personal care at home. They're using serums, toners, they're using sunblock. For crying out loud, sunblock is something that people don't use. And when they start using, even if you don't get any of these treatments done, your complexion will come back to normal.
Okay.
So it's the lifestyle choices, even eating healthy food, not eating a lot of processed meat, processed food. All this actually shows on the face. You know, Brian Johnson. Brian Johnson is very famous for longevity and the things that he's doing for his body. He's actually he's glowing.
Yeah.
And a lot of this is only because of his lifestyle choices. So I feel like the food that we eat also can improve how we look.
So we are saying that okay, treatments are good, but if you are having the lifestyle and food habits and everything, then everything sums up to make you a better personality or yeah.
Yeah, definitely it does. The what do you say, most easy regimen to have to make yourself lifted, tighter, and less puffy is to work out. Working out actually makes the body create more collagen, and it improves the skin and the hair, and thereby you start looking better, you start glowing. So, workout is the easiest way to have an anti aging routine.
That's true. But that's a hard working. Many people don't prefer to do that.
Yeah, but when you work out, you just don't look good outside, you also start feeling good inside.
Correct.
I guess
No.
once we all hit our 30s, mid 30s, we get to that point, right?
Yeah, yeah.
Where without working out, we cannot function.
That's nowadays you are doing
Yeah.
a good workout.
I am doing that, or else my joints will start making sums.
Yeah, I could see the drastic change in you.
Thank you, thank you.
So that's good. Um, so we have covered many treatments. Is there anything we can talk about non-surgical uplift? This is also a very common thing I feel, especially in many people. So yeah, would like to know about this in more detail about non-surgical uplifts.
Yeah. So, non-surgical facelifts is something that has been happening for the last, I would say, 10 to 15 years. What that means is that there was a point in science where we didn't have Botox, we didn't have fillers, we didn't have ways to take care of the skin. So obviously, by the time you would hit 50, 60, the person would look very aged. And you might have seen these videos online where the doctors do a surgery they along the hairline, behind the ears, and they lift the face, they lift the skin. They remove a portion of the skin and they lift the face. This is called surgical facelift. So, but now, ever since Botox and fillers and skin boosters and biostimulators, all these things have come. People are not aging that much. Their skin is not becoming loose. So it's like a preventive care. It's a preventive action that we are taking. When we do these procedures, there will be no need to do those surgeries as long as we take care of ourselves. Or you can delay it for a longer time.
ओके, तो व्हाट मतलब इसमें होता क्या है नॉन सर्जिकल अपलिफ्ट में?
तो नॉन सर्जिकल लिफ्ट में व्हाट वी आर डूइंग इज, पहली चीज ये है कि अगर हम बोटॉक्स अपर फेस में यूज कर रहे हैं तो यहाँ पर लाइंस तो होगा ही नहीं, स्किन तो यहाँ का टाइट ही रहेगा. तो बोटॉक्स इज वन पार्ट ऑफ लिफ्टिंग. Botox in the neck will actually stop pulling the face down. So the mid face and the lower face comes up. So this is also lifting. When
ओके.
we use skin boosters, we are actually injecting hyaluronic acid, which is the filler, or the thing that makes the cheeks very plumpy in children. So that's the same thing that we're injecting. So that way we are not causing aging, we're preventing aging.
करेक्ट.
And also, so then there's another reason for surgeries is people having a lot of loose skin, like significant amount of loose skin. If you are a mother who gave birth to a baby and you have now a saggy abdomen, which is beautiful in its own way, but some people would rather have the old body back. So then they would go for surgery for that. Some people might have a tight abdominal skin, but they have a lot of stretch marks. So nowadays we have treatments even for stretch marks without undergoing any surgeries. You don't have to go under the knife for
ओके.
having those kind of results. So that is what we call non-surgical lifts.
My next question, because we have covered so many treatments, my next question is, are these treatments good for the pregnant woman or who feeds? Are these treatments good for them? क्या उनको कराना चाहिए ये सारे treatments?
So for pregnant women, we generally avoid all sort of aesthetic treatments because pregnant women is a single unit, but it's two people. So we don't want to harm the child, the fetus. And so we recommend to make sure that if you are actively trying to have a baby, make sure that you are not pregnant before you come for these treatments. These days, a lot of women are doing IVF treatments. So we always recommend rule out pregnancy. We avoid it. Not that it is all the aesthetic treatments are not fit for pregnant women, but they have not been tested, and hence, and it would be unethical to test on pregnant. So we're not even going to inject those patients. And it's not just about injections, even when it comes to laser. Even though laser is non ionizing radiation, we recommend against even doing lasers during pregnancy.
And what about the patients who gone through the chemotherapy or survived the cancer? And what
In,
about the lactating mothers?
in case of nursing mothers, we advise them to pump out the milk after Botox and then feed the baby. Any other treatment like fillers and skin boosters should be fine. Definitely not get exosomes and stem cell treatments when they are nursing because the children are still babies and we don't want any kind of stem cells to be introduced into their body through the mother's milk. So in case of lactating mothers, every treatment is fine, but for Botox, we ask them to pump out the first milk.
And what about pigmentation and skin whitening? They are also safe?
We generally don't recommend to take any IV drips.
Okay.
If it is skin whitening like mesotherapy for targeted hyperpigmented lesions, that's fine because there is very low absorption into the bloodstream from the face. But to put directly into the blood vessels, that I would not recommend.
Okay, okay. And yeah, and what about those people who survive cancer and who pass through the chemotherapy? Are these treatments good for them?
So, for people who are undergoing chemo or has finished chemo, recovering from chemo, they actually want to look good. They want to feel good because they went through a very dry, rough patch of life. So most of the time, I have seen that these kind of treatments actually boost their confidence. They love the whole aspect of self-love, starting to look nice. They would have lost hair. They want to regain their hair. They would have lost facial fat, volume. They want to regain that back. Uh, Once we get approvals from their oncologists, we go ahead and do these procedures for them.
So
But we
it's
always check
possible.
with their oncologist. Yes, it is
Yeah.
possible, and it should be really considered uh, for such chemo patients because they would love it, and it's a feel good thing.